It absolutely has. We did an extensive literature search prior to undergoing our project, and what we saw was that stress was either incompletely captured in the literature, or there was focus on single stress domains, such as work stress or marital stress as it relates to myocardial infarction or heart attack, but never was stress looked at from a multidimensional lens, looking at multiple types of stressors and their comprehensive or cumulative impact on cardiovascular disease, which is what our study did. Absolutely. So to fill the gap in the literature that I just described, we created a cumulative stress score, which looked at four different subcomponents of stress: generalized stress measured by the perceived stress scale, neighborhood stress, financial stress, and psychosocial stress, and put those together to create a score. We use that score to look at cumulative stresses associations with cardiovascular disease outcomes and with cardiovascular risk factors in the Dallas Heart Study. And we found some very interesting things that lead us to believe that chronic stress is a risk enhancer for cardiovascular disease and should be looked at that way. So we saw that cumulative perceived stress, as measured by our a holistic score, was associated with cardiovascular disease, ASCVD or atherosclerotic cardiovascular disease, as well as global CVD and all-cause mortality. And the score was also associated with risk factors, acquired risk factors such as obesity and hypertension, and with health behaviors such as sedentary time, increased sedentary time, decreased time in moderate to vigorous activity. And so we postulated that stress may be an independent risk factor for cardiovascular disease, which is not accounted for by traditional risk factors, given what we saw with our associations of our score and our cardiovascular outcomes in our study. So the first takeaway is really to look at stress and to not be afraid to ask our patients about their burden of stress. The other thing that we found was that stress was disproportionately carried by traditionally marginalized groups such as African American, Hispanic individuals, women, and younger individuals. And so identifying those who are at risk for cardiovascular disease risk could include, identifying those who have a high stress burden. And in doing that, we may actually mitigate the findings that we saw in our study. And we can do so by aggressively targeting risk factors, traditional risk factors in these individuals, and by employing stress mitigation techniques that may actually reduce their risk of cardiovascular disease.